Welcome to Speak Sex. I'm your host, Eve Eurydice. I am your sex whisperer here in the internet. And today I have with me Dr. Cara Quant. Hey, Cara. She's
Hello.
with us from LA. Dr. Quant is an internal medicine physician, and she's also the founder of Viva la Vulva, an organization that educates on female sexual health and wellness, mostly through the arts, but through all media. So La Vulva's mission is to break down the barriers that stop men and women from talking and learning about female sexual health in a way that transcends race, culture, age, and geography. And I feel that we're both on the same mission because that's our mission.
It sounds like
too.
it, yeah.
Yeah. So you do it, our mission on Speak Sex is mostly to find the words, the language, right? And give people a new vocabulary, find a way to rewrite our sexual narrative, which hardly existed except from a place of like shame and secrecy and objectification and rape culture. and I feel that in order to do that, we have to unlearn before we learn. Yeah, we have to kind of unteach our social conditioning and unteach all of our judgments and social judgments in order to then replace them with something like healthy and positive. So and you do that more with through the visual arts. Am I right?
I do.
You put together shows, exhibits, events. Yeah, that bring the community together in that quest for change, basically, right? Social change.
Yes, in a big way. My Viva la Vulva has been around for a couple of years now, started in 2018, and that was when our first art exhibit was. And so it's bringing both the art and the medical communities together and having very powerful conversations around women's sexual health. So brought in artists who did some type of depiction of female anatomy, and then had near each piece some information about women's sexual health. Like, did you know that there's 8,000 nerve endings in the clitoris, and that the only use of it, or the only function of it is pleasure. There's no other function of the clitoris. So that information, amongst many other the types of information, were on the walls in regards to women's sexuality.
Right.
And then bringing panels.
Sorry. And the more pleasure, I just want to say, and the more pleasure, the more fertility, the more longevity for our little species.
Yes, I completely agree. I think that the more people bring pleasure into their body, whether it's sexual or non-sexual pleasure, but even the sexual pleasure, the more that you masturbate, the more that you have sex with a partner, the more that you explore, I feel like the longer you live.
Yeah, the longer you live, and you live from a place of expansion and not constriction, right? Instead of being like tight and uptight, you live from a place of openness and empathy. And then once you stop judging yourself, you can like move on and not judge others. So, wow, that to me, that's pretty revolutionary. Bringing us together so that we can heal each other from, this heavy weight of, I guess, Judeo-Christian patriarchal oppression and repression.
Yeah. And I would say most of the participants or the people that were at the exhibit, many males came up to me afterwards and was like, I did not know this information. Like, I didn't know what my partner was going through. I didn't know what my mom and my sister are going through in terms of periods, in terms of, we just covered a wide range of issues.
Yeah.
And it was gratifying to hear that from the males out there, that they didn't know this information, but they're glad that they came to the panels or came to the opening night. So it was a lot of awareness on my part of like what information is missing? I know there's a lot of information, but like what
there's so much
is missing and what people
missing.
hold on to. What people hold on to. So
what do people hold on to, you think?
In terms of like the
from
information?
Everything from the information, like what strikes them as most I do agree. I think it's a disservice to men. I'm giving you a moment to think. It's a disservice to men that we just take it for granted that they know what to do and they know how to behave and they know how to behave with every woman.
Yeah.
And so it puts them in a really awkward, misleading position socially. And of course, like their only recourse is some form of rape, meaning let's just get it over with. Let me just ejaculate, and because I don't know what I'm doing and no one is telling me. And she, and if she has feelings for me, she expresses them by pretending to like it, because that's how she shows me she likes me or she loves me or she wants me. So it's like a clusterfuck, a mental clusterfuck where no one tells the truth.
That's a perfect word.
Yeah. Hey, we keep perpetuating, like we're going down this, this like rabbit hole. But none of it is honest, and we can't begin to access our honesty. There is no like standard, right?
Yeah.
So I feel like the fact that you're a doctor and it gives you a perk, it gives you the social, let's say, status or respect, unfortunately, but that's how things are, right? So it gives you an ability to integrate right and left brain, which we need to do, all of us, in ourselves, more readily, because, you're an MD, so people feel like, okay, this is not like, an XXX convention. I can hold on to, but that's the judgment, unfortunately.
That is,
even though adult means we're all adults, we're not, 20, we're not 18 or 16.
Depending on where you are.
But it has that extra, extra moral judgment, that extra value system that's kind of like demeaning. And I feel that that's because we reward the masculine. So like medicine is like the masculine side of our mind. It's like numbers and, concrete information.
Logic. And path.
And like understand. Pleasure is like a feminine part, indulgence, lack of whatever, clarity, intuition, all that. So, I think that you have definitely, a stronger voice in the current system because you come from the medical profession.
Yeah, and thank you. And I think the reason why I wanted to do this is because I felt like it was two parts. It was like a personal thing. I wanted to do it for myself because as a young adult, I would go to clinics and I would ask questions regarding sex, around sex. And the doctors that I saw in these clinics didn't know much information or like weren't answering my questions the way that I guess I wanted them to be answered. And so I have always wanted to be that doctor that people could come to and ask very frank questions, ask questions about sex and get good information or get at least resources that they can go to in order to help them if they're having pain with sex or problems with orgasm or on the male side, erectile dysfunction or premature ejaculation. There's a lot of things or problems or issues that I feel like patients don't feel like they can address because they don't know if their doctor can handle it. So I've always wanted to be that doctor. And what I realized in medical school and in residency for myself is that there was not a lot of information about women's sexual health, about, what treatments there are or what resources are out there like sex therapists and pelvic floor physical therapists. And so I started doing my own research in order to find this information out. So I think it was also wanting to educate the medical community about like what is out there, like what women go through and what resources are out there for
that's
us.
that would be like an amazing, initiative to actually get doctors to take, workshops and, attend conventions twice a year where they catch up and learn on what's happening in the sexual health and wellness realm, and how to talk about it and how to approach it, right? Because they, as we just said, they are like a respectable source of information, and they get one-on-one time with so many people. And if they can bring the conversation into it, just ask the question. I'm sure people would love to kind of like share, and kind of like speak their truth because of where they're at. They don't feel so much that they're judged. If you can talk about like whatever your incontinence or, right, you feel comfortable talking about everything that your body goes through. But
and there's some women or men, there's some people that just don't feel comfortable with talking about it. Or when they do, it's just very like, it's at the end of the visit. So it's like, hey, doctor, before you walk out the door, let me tell you about this thing that's been going on that I've had on my mind throughout maybe most of the visit, but I didn't tell you because I was embarrassed to talk about it. So that has happened a lot of times. And
that's why the doctor has to ask to open space for that. If the doctor says, by the way, then the patient doesn't feel that they're taking up their time, or that maybe they're doing something that doesn't fit in. But I feel that it's important to educate our doctors, our medical community, not to come from a place of illness, and disease, because doctors are so much trained to like fix things. But here, with sexual wellness, we don't even have a standard of health yet. So,
no, we don't.
Right. So to call everything like therapy and come up with like, medical treatments and drug treatments and surgical treatments, when we have hardly like, established a language of like, what works and how do we go about being better, taking care of ourselves sexually. We don't have that.
And that brings me to a quote that I saw recently, talking about illness versus wellness. And if you take out the I in illness and change it to we, it'll be wellness.
Yes.
And I feel like that was such a great quote because there are so many people going through illness. But I feel like as we come together in circles, especially women's circles, but just circles in general, men's circles, coming together as a community can really help other people to know what other people are going through, and relate that to what we are going through. So I feel like it's just such a great quote about illness to wellness and focusing on it. There are a lot of conferences that are out there. And I mean, I've attended these conferences because I wanted to know more information around women's sexual health. There is one called ISWISH, which is the International Society of the Study of Women's Sexual Health. And they do talk about treatments. I mean, it's medical community, doctors of all kinds, family practice, OBGYN, urology, that come together, sex therapists, pelvic floor physical therapists, all coming together to learn this information. But a lot of it is based on, well, if a woman has an issue with orgasm, then these are medicines or these are treatment options for her. I do believe, I mean, even though I'm coming from Western medicine and this is what I've been taught, I do believe that there are other ways of coming up with a solution or with experiencing more pleasure in the body rather than focusing on the problem per se.
Yeah. Well, I think part of it, again, speaking of like the society having an overall strong masculine slant, is that, pleasure, investing is even the wrong word, seeing how that like monetizes things. But like, taking time out for yourself, giving time to yourself and to your pleasure feels these days like an indulgence that we should not, that it feels like a self-indulgence that's almost like not morally acceptable, when we have so much that we're busy with and catching up, with, and the world, technology are changing and evolving quickly, and home and, responsibilities, bills, right, children, to take like half a day off, feels like almost
and turn on
perverse.
social media.
It feels like perverse, like you feel like,
Yeah.
wow, well, like what is wrong with me that I want to spend more than like 5 minutes, right, with my sexual self, with my sexual energy, when like so much is going on in the world, as if what that's where we start.
It feels self-indulgent, and I mean, I could even speak for myself on that. Like, there's times where I'm like, I need to unplug, I need to get away from social media, I need to get away from I just do something that like is calming and relaxing and self-care focused. But oftentimes that can feel selfish, or it can feel like this is not right. Like, I should be working and doing and going. And,
right.
But I think a large part of our, especially us as women, is to, sit back, relax, self-care, take care of, taking care of ourselves.
But for sure for women,
be a little selfish.
For sure for women, and I don't think it's selfish. I think it's holistic to create a balance, because we're pushed too much to be in our masculine kind of like achiever, be like the man out there in the world aspect, and we need to find our balance by spending more time in our feminine, pleasure loving, relaxing, whatever, nourishment, nature, children, home, that aspect. But I feel that for men too, if they take time off by themselves, they will discover their own sensations better, and then they can receive better when they're in a couple. If you take, like, as a guy, 3 hours or 4 hours, right, and you experiment with yourself, in masturbation or toys or whatever, fantasy, then you learn these things and you learn how it feels, and you can introduce it, more confidently, right, to your exchange, to your sexual exchange with a partner. So I think it opens up everyone to give ourselves time, and it's an expression of self-love, like even touching yourself, taking time to touch your skin and feel how you feel to your fingertips is important, because this is all you, right? And you don't want to only depend on like other people to, exactly, like hug yourself, hug every part of you, like touch base and say, we're here, like, and
actually, a sex therapist has taught me that about what is it called? Sensory awareness. But it's basically where you take some time out to just be with yourself and to touch yourself, not in a sexual way. You're not touching your breasts, you're not touching your vulva or your penis, you're not touching any kind of more pleasurable parts of yourself, but you're doing just touching over your body, just seeing how, sensate focus, that's what it's called, seeing how your body feels,
right.
The different sensations, like focusing on those.
Right. And there are like 5 types of touch at least. So you can start with the most, let's say, innocuous, and move on to, something a little more sexual, or a little or more invasive or more experimental, but you see, it's just an issue, like even saying it feels like we're speaking it, just saying it, much less doing it, just talking about it, to some people in the audience will feel like icky, it will feel like transgressive, it will feel like there is a barrier of propriety that we are crossing, right? And we shouldn't. So I think that's the important thing that we are, working around all the time, is how to marry, respectability, respect and social acceptance in general, right? And prestige with what is natural for all of us in our physical realm, in our physical and sexual existence. And that is easier said than done, because we have like what, 2,000 years, I guess, at least, maybe more, in Judeo-Christian, 2,500 years of ongoing kind of like, propaganda and, mental brainwash against it all. And I don't think it's because patriarchy is, supporting the man. I think, patriarchy is supporting the rule of the patriarch, right? The father, the ones in charge, the ones who are like monetizing and controlling the whole system. And our sexual experience is chaotic and unpredictable. So it can't be so simply quantified, and
Well, I think that's what your podcast is about, right? Like speaking sex, like talking about sex, communicating what you want.
Right. I'm trying to do a number of things. One is to just at the most basic level, expose the audience to all kinds of, conversations about sex and all kinds of people talking about, sexuality, just to kind of make it familiar, to break down that, self-consciousness. And then on the next level, I'm trying to help people get new words, new ways to express what they feel or what they want, words that don't come with all that judgment, that can be freed from like the whole like moral or critical imperative, let's say. So that's not easy, because we kind of have put sexuality in a corrupt space.
We have,
and sinful, which makes no sense with logic, but logic, is always like kept apart from sexuality, unfortunately.
Yeah, exactly. And I think that when you get into when you get into the groove of sex with a partner or even by yourself, logic kind of goes out the window, right? Like it goes out the window, and we are allowed to just be in a space and like with a partner or by ourselves, where we're just enjoying the sensations and the feels of whatever comes up. And I think that for myself has been a little hard, because I have been trained to think very left-brained, like a very logical, if this, then that. If someone comes in with this type of condition or these type of symptoms, and this is what I'm supposed to do. And so, and I feel like that's for much of society, rather than like feeling what is going on in the body. And I think that's the reason why I wanted to do Viva la Vulva and create it, is because I wanted a space that allowed me to be more creative and to be more right-brained, because we have a full brain and we don't even use all of it. And so just figuring out different ways for myself, as therapy, as solutions,
education,
problems, as education, as a lot of different things. And so using your right brain, that more maybe feminine part, that more sensation focused, or it's not as logical. That is a good thing to tap into every once in a while. On a regular basis, actually. Not every once in a while. On a regular basis.
To create like balance with ourselves, because, most of all, we are this like, physical body. And if something goes off with this physical body, then all of our grand schemes and master of the universe, ambitions stop. So as we have experienced, right, during the pandemic, our extraordinary logistics, organization failed us. So, hey, like the left brain is definitely, I think, not as ubiquitous, and as we assume, we cannot control nature, and we cannot control ourselves, just by, just because we have the delusion that we can.
Yeah.
So it's better to accept, just accept what is, accept you as what you are, and keep learning, who you are, and how to live your life in the best, most balanced way, and do it actively, like you did, bring it out in the world, like, bring more people into it. And it's a labor of love. It's, it's a labor of also hope and belief in each other, right?
Yeah. And like I feel like we all have a gift or gifts that, we have to, that we can choose to bring into the world. And I think Viva la Vulva is one of the gifts that I have given to the world, because this is, as you know, this is a very taboo topic that we're talking about. We're talking about sex. We're talking about something that is very fundamental, like basic. We need to do it in order to survive, in order to continue generations on. But there's a lot of
stigma
stuff, stigma, shame, embarrassment, all types of stuff that is like interwoven into this topic. And so talking about it in a very just like to normalize the conversation, I feel like is great, especially for women. I think that for men, like it's not as, from my perspective, I think for women, it's a lot harder to talk about sex, or to like get pleasure, or to be okay with saying no, talking about boundaries. I feel like it may be a little bit harder for women than for men. And so just normalizing the conversation. It's not, but also like
look
topic.
At what the conversation has achieved. Like a generation ago, there was no idea of what date rape was. No one spoke of coercion being an extension of consent. If you started by saying no and you ended up saying yes to sexual encounter because the guy wouldn't give up, that was considered consent. Right? It was not, it was, if you were kind of pressured until your only choices were to call 911 and report a non-existent, basically, rape, right? Or just give in, and you gave in, then you told yourself, okay, I gave in, I consented, so I guess, whatever, I shouldn't have put myself in that situation where I was like alone with a man. So we've come from there to now, right? And we're trying to, educate our younger men about, this sort of like respect that includes listening to what the woman says and wants, and preparing the woman. Because if you know how, the female body works, then, you can get yourself that acceptance, a sexual acceptance or a sexual invitation in ways that are, more inclusive than force, either physical or verbal or financial, all of those, other ways of kind of like making yourself, get inside a woman's body when she really doesn't want you there. And I feel that, the stigma is what has made us kind of like delay so much in getting here, because those who talk about it openly a lot in public get, stained, they get marked in some way, right?
Yeah.
So you lose some of that social value. It's again, it's a task worth pursuing. It's worth giving up whatever that.
It is. I was going to say, or actually what I thought of when you said that is a party that I went to pre-COVID, pre-coronavirus, a party that I went to a couple of years ago, actually in promotion of Viva la Vulva. And these were, I would say, between the ages of 30 to 60. And I had a conversation talking about Viva la Vulva. And I remember having a great conversation with these other women, and there were some men that were in it, but it was mainly women, about orgasms. And we just had a great conversation about, like, you know, how often we have it or don't have it, or like what feels good or doesn't feel good. It was a great conversation. Women of different races and ages talking about at a party. And it wasn't a sex party. It was just a regular party having a conversation around orgasms. And I thought that just brought joy to my heart, because it was, I mean, who talks about orgasms at a regular party?
Exactly. Even the word itself, like, it makes everybody react differently. Like, what?
Yeah.
That's what we're talking about.
That's what we're talking about.
We've given up all pretense. Yes,
and the more people heard it, like, you know, it was almost like the group kind of grew bigger. The more people heard it, the more like, oh, what are you guys talking about? This is an interesting topic you guys are talking about. Let me join in. So I think that people are thirsty for the information. They want it. They want to talk about it. But it's finding the right outlet, the right platform to do it.
Exactly. It's a matter of platform that's accessible and, and acceptable to most people. And I do think that, people of color are especially oppressed, especially women, women of color. I don't know if you have your own view on why that is. I feel that, when you have that legacy of oppression and suffering, right? You don't dare ask for more, in a sense. You just, we have been in survival mode for so long, basically ever since, more or less they came to this country. So, the idea that not only you want freedom, not only you want equality, not only you want some basic rights, but you also want to, like, have a good time and, have pleasure and be respected. Like, when you're naked in private, feels like that's too much to ask, right?
Yeah. Yeah, I mean, well, as a Black woman and as a doctor, like, I feel like, yes, there has been, the topic there's, I think, more embarrassment and shame around the topic amongst the African American community. And I think because many of the women have been, actually many Black people are sexualized, it's strip clubs and
exotified.
Yes, exactly. So there is a lot of stigma around the topic, especially for people of color, Black people in particular. And I mean, that is also another thing that I want to bring to the art exhibits, is talking about these topics around sex and diversity, because it can be considered dirty. I mean, like, I know growing up, I'm non-denominational, or at least growing up, I was non-denominational. So going to different things like Catholic churches and Christian churches, and and being amongst Black people, we didn't talk about sex. We didn't talk about masturbation. We didn't talk about, having sex, or sex is pushed off until marriage. Like, you don't do that. No one touches you. You don't do that. And so what about the people who are having sex? Where is the information? Who can I go to that I can trust to give me good information or regarding either protecting myself or the pleasure of sex? So I have also wanted to be the voice that, people can come to and talk to about whatever they want to, and get either resources or some things that they can do in order to make sex more pleasurable. But it's a big stigma within the Black community.
Yeah. I mean, I compare it. I know what I'm going to say is controversial, but that's really what I believe. I think that the same way that women, even through feminism, they have earned some freedoms by embracing the masculine. So, the only way basically for a woman to get respect, at the level of men getting respect is to go out there and get a job that men could do and do it as well or better than the man, and dress as close as she can to the man in some sort of uniform and sound like a man, her voice, her vocabulary, all of that, right? And we do not pay motherhood. We do not pay, for our own, pleasure time. All of that is completely devalued. So in the same way that like women, even through their own efforts as feminists, have gained equality by copying the men, I feel that, people of color have had to kind of internalize like white men's world and copy it and behave in that way in order to be accepted and get a modicum, right, of power and equality. So
yeah, I mean, what? Oh, sorry.
Yeah, so no, it's the old saying, like, you don't take down the master with the tools of the master. I feel that, both is, we're oppressed for sure. And I feel that, it's true for both people of color and women in particular, that, we can only find our own authentic voice and authentic power by not replicating the system, by not fitting in too much, by not trying to be like what we consider the normative majority. Yeah.
Yeah. And I mean, I think that is the reason why we're in where we're at in terms of Black Lives Matter, in terms of the movement that's been happening, in terms of protesting for George Floyd and Breonna Taylor and all of these other people who have been killed by police violence. Or just white supremacy in general. Voices have, I think that in particular, Black voices in the past, and still it continues to happen, have been repressed, or Black people feel like they don't have a voice, or whatever it may be. And so I think that this is the time where more people are speaking out about what matters to them, what matters to us. And yeah, that's a big thing. I'm not going to be paid as well because I'm Black and because I'm a woman. I'm not going to, be respected because of what I look like. And so it's not fair. And so there is protesting that's happening. And, we would like to live in a just society.
Yeah, which America...
That's what we want to...
Yeah, which America purports to be. But yeah, I don't think it is. Yeah, and what matters is for us to remember this, so it doesn't like pass and then we go back to our usual life.
Normal.
But yeah. So there is like the optics, and there is the performative, people going out to the streets and, they have been cooped up anyway because of the quarantine, and but there is also like the authentic change, how do you incorporate and internalize that so that you change the way you think, you change the way you treat other people, you check in with yourself every day, and make sure that you have stayed true to that. And I feel that that's what will make the world change forward, like move forward into this millennium we're in, the new millennium.
And in terms of the medical community, because there's so many racial injustices in different places. So within the like the jail system, within the working system, within the medical system, and in particular the medical system, it's why do Black women have poor health outcomes when it comes to childbirth? Why do Black women have either they die from childbirth. It doesn't matter what socioeconomic status they are, or have more complications from it. And so there are a lot of injustices that can be taken care of by speaking up more and talking about it. And I also think that the education around it for medical students, or maybe even before medical school, but in particular for training doctors, to have more ongoing conversations about the injustices that are in place that can be changed. Access to healthcare.
Access to healthcare is huge. I mean, I just can't even, as someone who was born in Europe and spent like my life just going to the doctor for free until I came here, the idea that, there isn't free healthcare for every citizen in the richest country in the world is, inconceivable to me. And
it is.
And then, when you do the math and you see how profitable the private, healthcare companies are and how much money they spend to keep things the way, they are, then you have an understanding of the reasons why. And so, we have to, if it takes like staying on the streets and asking for this specific, specific rights. And I feel that free access to healthcare is a specific human right. If we have the doctors and if we have the hospitals, we should be able to go in.
Yeah. And there are county facilities, but you're still paying out of pocket for something. There's still places where you can go, either like free clinics or county hospitals. If you can't pay, then you can't pay, but there is some cost to it. You're not just getting it for free. And so there's a lot of people that, I mean, even from my own experience, I've had patients that I want to order a CAT scan on because I feel like this is indicated based on what their symptoms are. I want to rule out appendicitis, or I want to, rule out something. And they're like, well, how much is that going to be? Like, how much is that CAT scan going to be? And I'm like, I don't know how much it's going to be. Honestly, I don't know how much that's going to be for you out of pocket. And just to even have that conversation about, like my health depends on how much I can pay or not pay. It's horrible. It really is. It's horrible. And yes, everyone within the U.S. should have access to healthcare, free healthcare.
Yeah, absolutely. Absolutely. And it would cost nothing, like considering the money that gets wasted on so many other things.
Yeah.
And I saw like, health insurances put out a notice that people who get COVID by attending protests will not receive health care. I mean, first of all, like this whole
how do you even
I know. How
figure that out?
I don't know. They're just trying to keep people at home. But like, why do you participate in a political discussion? Like, just, mind your business. They're trying to basically control the conversation through fear. Yeah. So it's always fear. It's like fear of the body, fear of being shamed, fear of being shunned, fear of being ostracized. So, whatever we may think or we suppress, we don't dare speak up because we don't want to be outliers and outsiders and get out of like the main feed.
But at this point, like things are changing and shifting in a major way.
Too. Yeah.
And we are having these conversations that otherwise we wouldn't have had. So I think that it is a great time that we're in. If we can see the silver lining in it, if we can see that there's like I feel some massive transformation that's happening.
Yeah, I do too.
And if we continue that, then we can get to a place of equality.
Yes. Hallelujah. So, I do feel like the dream solution would be for an army, like an army of volunteers, maybe organized and paid by the government, who go out there and engage people and teach them, about their physical needs, the healthiest things to eat and how to practice them on a, sustainable, long-term basis, the best ways to, the best type of water to drink, the best way to, exercise, what things in their house are toxic and they should address. And then the same with their body and their physical pleasure, the best way to relax, the best way to have an orgasm, the best way to find pleasure, the best way to express yourself within that, right? To like know how you feel and say it. So it's all interconnected, and it's the realm of the body, which is the realm of the feminine, that we're, the domestic sphere, and it has been ignored for centuries.
Yeah, and I think that it is up to us as women to take it back, to reclaim it.
Yeah, we need to reclaim it,
own it. So there's a lot of people that are out there that you can connect with, either on social media or different programs that teach this information about how can we be more holistic, how can we stay away from the medicines, and more to less, what we put in our body on a regular basis.
Yeah, and be less needy, less dependent, less passive. So, remember that we are in charge of our well-being, and then we're in charge of the well-being of our children and their children, and so keep those priorities in mind instead of having the priority of fitting in or making a few extra dollars, because it feels like, the domestic realm, which is the realm of actual wellness instead of illness, right, is not being monetized. So that's the way that the patriarchy controls our values. What you get paid the most for is what you should consider good, and what you don't get paid for is what you should ignore and not discuss, which includes everything from grocery shopping to, raising your kid. That
which
huge
is a huge
category.
Thing. I mean, women, for a woman to raise her children. I mean, I've never raised a kid, but I know I've seen it with my mom. I've seen it with, friends of mine. It's not an easy feat. It is not an easy feat.
No, that's another one of my...
even the maternity leave, getting paid, or how long amount of time a woman can get paid to be on maternity leave, where she's taking care and raising a child, of course, or with or without a partner, but raising a child. And yes, there is a huge value to that.
Yeah, exactly. And the society owes us. I mean, that's been one of my pet peeves, and I've talked about it pretty much, since the beginning of the podcast, that I think, motherhood should be paid. It should not be something that we do for free for 20 years, basically for the rest of our lives, when it's the most time consuming and the most important work we do, So instead of having to go work a full-time job and then take care of our children and, go grocery shopping and feed everybody and clean up and do all of that stuff, I think it should be reversed. There should be an income for for when you are a mother, and then you can do your work, your outside work, non-domestic work, for extra income or not, but you're not dependent on it, It kind of bring value to what women do on the feminine, realm of our lives. I think that would change a lot, for sure, including the dependency of women on the men that they are, either married to or, somehow with.
In a relationship
where so often women feel if I want someone to take care financially, I have to pretend and lie. And so,
and it doesn't, it doesn't need to be that way. I believe, women need to be empowered more. And it is happening to where there are more women in power and talking about women's related issues. And it needs to continue.
Yeah.
It does. It needs to continue. Yeah. And there are, the big companies out there, like the Googles and the Amazons, that I do believe give maternity, more time for maternity and even paternity leave. So I feel like there's shifting. There's definitely shifting that's happening, and focusing on that continue shifting.
Yeah. Well, yeah. This conversation, is key. Education and speaking about it is definitely key to growing our understanding and sharing these thoughts. So
yes.
Well, thank you for coming. Thank you for speaking with me. And again, congratulations on Viva la Vulva. I hope that you take it, to many more places and keep growing it.
And that is what I plan on doing.
That's great. That's great. Yeah.
Yes.
I love that.
Thank you for having me on. And
My
yes,
pleasure.
I appreciate you and I appreciate what you're doing. And I'm glad that we have come together to have this conversation because, I feel like there is synchronicity in this world. And that the more that you align with your passion, the more that you meet other people that are along the same journey. So I'm happy to have met you and have done this interview together and continue normalizing the conversation around sex.
Yes. Amen.
Normalizing it. Yes. Amen.
Thank you. And thank you everybody for listening. And until next week, speak sex and believe Eve. So we're excited to announce our partnership with oldplayground.net. It's the site to go to if you're in any way curious about what to do next in your sex life. If I could make love incessantly, I would be God.